Hello everyone, welcome to my video on biomechanics of posture, understanding your body's blueprint. So posture is something we often ignore in our daily lives, whether we are sitting, standing, or even using our phones. But in reality, posture plays a very important role in maintaining our overall health, preventing injuries, and improve movement efficiency. So in this video, we will understand what posture is, how gravity affects it, what ideal posture looks like, and also discuss common postural problems and how to correct them. Yeah. So, what is posture? So, posture, as we all know, it is nothing but posture refers to the alignment and positioning of different parts of a body in relation to each other and also in relation to gravity. So, it is not just about standing straight or sitting upright, it is actually the foundation for all movements that we perform in our daily life. So, whether it is walking or lifting or even breathing. So, good posture helps in distributing body weight evenly across the joints and muscles. So, this reduces the unnecessary stress on ligaments and prevents fatigue. On the other hand, so poor posture can lead to muscle imbalance, joint pain, and even tendon deformities and stuffs. So another important point is that posture is dynamic, so it keeps changing depending of what we are doing. Yeah, what are the types of posture? So now let's look different types of posture. So the first thing is neutral or ideal posture. This is the correct alignment where the natural curves of the spine are maintained. So then we have abnormal postures such as kyphosis, lordosis, and scoliosis as well. So kyphosis, where there is excessive curvature of upper back leading to a hunched appearance, whereas lordosis, where the lower back have an exaggerated inverted curve, often seen in people with weak core muscles. So whereas scoliosis is nothing but the sideways curvature of the spine, which may appear as a S shape or a C shape. So these deviation not only affects the appearance but also disturbs the body's balance and efficiency as well. So coming to line of gravity, now let's talk about the line of gravity is an imaginary vertical line that represents the direction of gravitational force that is acting on our body. So in an ideal standing posture, this line passes through the specific landmarks such as ears, shoulders, hip, knee, and ankle. When this alignment is maintained, the body requires minimal muscular effort to stay upright. However, if this line shifts forward and backward, the muscles have to work harder to maintain balance, so which can lead to fatigue and pain over a period of time. So center of gravity. So center of gravity is the point where the entire body weight is considered to be concentrated. So the human it is actually located around the pelvic region near the second sacral vertebra. So this point changes whenever we move. So for example, when we bend forward or lift something, the center of gravity shifts. So a lower center of gravity increases stability, which is why athletes bend their knees slightly during activities like lifting weights or playing sports. So maintaining proper control of the center of gravity is essential for balance and coordination in which we are doing. Yeah, coming to the optimal posture. So in optimal posture, the body segments are aligned in straight line. So if we observe from the side, the ear should be aligned over the shoulder over the hip over the knee, and the knee over the ankle. So the alignment ensures that the load is distributed evenly and reduces strain on muscles and joints. So the head should not protrude forward, the shoulder should be completely relaxed, and the pelvis should be in neutral position. So this type of posture improves the efficiency and reduces the risk of injury in such patients. Coming to postural deviation, so forward head posture is very common due to excessive phone usage nowadays. So it increases strain on neck muscles. So round shoulders occur due to prolonged sitting and poor ergonomics, leading to tight chest muscles, weak back muscles. So anterior pelvic tilt results in exaggerated lower back curve and can cause lower back pain as well in such cases. And all these deviations disturb normal biomechanics and can lead to long-term complications if it is not corrected. Now coming to the factors affecting posture, so the first thing is poor ergonomics, such as improper chair height or screen position can lead to bad posture. So wearing inappropriate footwear like high heels can also shift the body's alignment, and muscle imbalance where some muscles are tight or other muscles are weak also plays a major role in such things. So technology usage, especially prolonged phone or laptop usage, is one of the most biggest common causes nowadays, and even genetics and structural differences also plays a major role in posture. So this is all about posture, and thank you for giving me the opportunity to share such